Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. Don't forget to hit subscribe, like, and leave a comment below to let us know the health topics you're interested in. Your support helps us continue bringing you valuable content. What is osteoporosis? Osteoporosis is a condition that silently weakens your bones, making them thinner, more brittle, and more prone to fractures. Unlike many health conditions, osteoporosis doesn't come with noticeable symptoms. Most people discover they have it only after a bone fracture occurs, often from a minor fall or injury. Healthy bones are dense and strong enough to support your weight and absorb most impacts. However, as you age, your bones lose some of their natural density and ability to rebuild themselves. For individuals with osteoporosis, this bone loss accelerates, making bones fragile and susceptible to fractures. Common fracture sites in osteoporosis. People with osteoporosis are at risk of breaking any bone, but the most commonly affected areas include hips, hip fractures, wrists, spine, vertebrae. Fractures, particularly of the hip or spine, can have life-altering consequences, including chronic pain, reduced mobility, and even loss of independence. That's why early diagnosis and treatment of osteoporosis are crucial. How common is osteoporosis? Osteoporosis is incredibly common, especially among individuals over the age of 50. Over 50 million people in the US live with this condition. About 1 in 2 women and 1 in 4 men over 50 will break a bone due to osteoporosis in their lifetime. In addition, 1 in 3 adults over 50 have a condition called osteopenia, which means their bones are weakening but haven't reached the point of osteoporosis yet. Without intervention, osteopenia can progress into osteoporosis. Symptoms and causes of osteoporosis: the silent disease. Osteoporosis is often called a silent disease because it doesn't cause obvious symptoms. You won't feel pain or notice any warning signs until the damage has already been done. However, there are subtle changes that might indicate weakening bones. Loss of height. If you've shrunk by an inch or more, this could be a sign of spinal bone loss. Changes in posture. Stooping or bending forward more than usual could indicate vertebral compression fractures. Shortness of breath. Compressed discs in the spine may affect lung capacity. Lower back pain. Chronic lumbar spine pain might be linked to bone degeneration. Sometimes, family or friends notice these physical changes before you do. It's important not to dismiss these warning signs, as they may signal the need for a bone density test. What causes osteoporosis? Your bones are living tissue, constantly regenerating throughout your life. Up until about age 30, your body builds more bone than it loses, but after age 35, bone loss begins to outpace bone formation. If you have osteoporosis, this loss occurs much faster, leaving your bones fragile. Some key causes and risk factors for osteoporosis include age. The risk of osteoporosis increases significantly after age 50. Menopause. People assigned female at birth are particularly vulnerable due to reduced estrogen levels post-menopause. Genetics. If someone in your biological family has osteoporosis, your risk is higher. Body size. Smaller, thinner individuals tend to have less bone mass to begin with. Lifestyle choices. Smoking, excessive alcohol consumption, and a sedentary lifestyle can increase the risk of osteoporosis. Certain medical conditions and treatments can also accelerate bone loss, such as endocrine disorders, thyroid disease, diabetes, autoimmune conditions, rheumatoid arthritis, gastrointestinal diseases, celiac disease. Certain medications, corticosteroids, diuretics, and proton pump inhibitors can increase the risk. Diagnosis and tests for osteoporosis. The gold standard for diagnosing osteoporosis is a bone density test, also known as a DEXA scan. This imaging test uses low-level 10 rays to measure the density and mineral content of your bones, helping your healthcare provider assess how likely you are to experience fractures. A bone density test is simple, non-invasive, and only takes a few minutes. It's recommended for individuals over 65 years old or those with a family history of osteoporosis, previous bone fractures, or other risk factors. Treating osteoporosis. Treatment for osteoporosis focuses on slowing bone loss and preventing fractures. The following approaches are commonly used. Exercise. Regular, weight-bearing exercises like walking, yoga, and Tai Chi help maintain bone strength and improve balance, reducing the risk of falls. Strength training and balance exercises are often recommended to help stabilize muscles around the bones. Calcium and vitamin D. Adequate calcium and vitamin D are critical for bone health. Most people can get these nutrients from a balanced diet, but supplements may be needed for some individuals. Medications. Medications for osteoporosis can help slow bone loss, promote bone formation, or improve bone strength. Common osteoporosis medications include bisphosphonates. These drugs slow the breakdown of bone tissue. Hormone replacement therapy. This can help postmenopausal individuals manage bone loss. Parathyroid hormone analogs and denosumab. These newer medications are typically used for severe cases of osteoporosis. Prevention. How to lower your risk of osteoporosis. You can take several steps to lower your risk of osteoporosis. 1. Get plenty of calcium and vitamin D. Dairy products, leafy greens, and fortified foods can help provide these nutrients. 2. Stay active. Engage in regular weight-bearing exercises to strengthen your bones and improve balance. 3. Avoid smoking and limit alcohol. Smoking and excessive drinking can weaken your bones. 4. Fall prevention. Keep your home clutter-free, use handrails, and make sure you have proper lighting to prevent accidents. Living with osteoporosis. What to expect? If you have osteoporosis, it's essential to manage your condition carefully. Regular checkups, lifestyle adjustments, and medications can help you live a healthy, fracture-free life. Since osteoporosis is a chronic condition, you'll likely need to manage it for the rest of your life, but early intervention can significantly improve outcomes. A note from Dr. Mai. Osteoporosis can be dangerous because it doesn't present obvious symptoms until it causes a broken bone. The good news is that early diagnosis and intervention can prevent bone fractures and help you maintain a high quality of life. Don't wait until a fracture occurs. Talk to your healthcare provider about your risk factors and schedule a bone density test if necessary. Thank you for joining us today. Don't forget to subscribe to the channel, like, and comment below with the health topics you'd like to see next. Your engagement helps us create more informative content for you. By understanding the risks, symptoms, and preventive measures, you can take proactive steps to maintain your bone health and avoid the serious complications associated with osteoporosis.